Hello, my name is Brett. I'm a graduate student at Texas Women's University in Houston, Texas, School of Occupational Therapy. This here is Dylan. He's my patient. He's 11-year-old. Today we will demonstrate the examination of the shoulder. Okay, so as we begin with the shoulder examination, it's best to perform it while the patient is standing. The shoulder joint is a complex joint with three joints and one articulation. At the joint, we have sternoclavicular joint, we have the acromioclavicular joint, and we have the glenohumeral joint. And on the back here, we have your scapulothoracic joint, or articulation. With any joint examined, first we must look at it, palpate it, and move it. So the first part, we'll look at it. I'll point out the structures. We have your sternum here, your clavicle here. This here's your sternoclavicular articulation. This here is your acromio articulation. Right here is your anterior line. This here is your acromion. And this is the humerus. Back here is the spine of your scapula. And on top, you have four rotator cuff muscles, your supraspinatus, infraspinatus, teres minor. Inside your scapula is the subscapularis, and here on top is your thoracic. As we continue looking at the shoulder joint, look for scars, swelling, and redness. Scars, the most common, are on the anterior line of the glenohumeral joint used with rotator cuff surgeries. Okay, next we'll place our thumb at the midpoint of the acromion and externally rotate the arm. And here, you'll find the bicipital groove where you can feel the tendon of the bicep. Continue to palpate down the humerus and along the spine of the scapula for tenderness in this area. It's also important to feel the rotator muscles as well. Here's your supraspinatus, infraspinatus, and teres minor. And here's your trapezius. Okay, as we continue on with our shoulder examination, we've looked, we've felt, and now it's time to move the joint. So what I'll do, I'll have the patient abduct his arm, if you will, both arms above your head like this. At 120, it's the glenohumeral joint, and then the last 60 is the scapulothoracic articulation. And here we're just looking for the smoothness and the extent of the movement. If pain is found here on the first 120, 60 to 120, then you have impingement. And the last 60, there'd be issues with your acromioclavicular joint. Next, we'll have the patient lower his arms, and now, behind your head for me. And extend the elbows out. And this here is functionally important movement in your ADLs. You can put them down. Next, I'll have the patient again abduct both arms over your head, palms out, like this. And put your palms out like that. And then slowly drop your arms back down. If pain's felt here in the first 120 to 60, then you know it's a rotator cuff injury. Continuing, we'll have the patient bring his arm across his body and grab your shoulder. Use this hand to grab that shoulder. And here, this is a functional movement for dressing and bathing. And also, as I applied there, it stresses the AC joint, known as the Scarf's test. Turn sideways. Sides here. Okay, here we'll have him, again, flex his arm over your head, straight, and then bring it on back down, and then bring it back towards me. So we've checked for shoulder flexion and shoulder extension. Next, I'll have him bring his fingers and arm up behind your back. Turn around, like that, behind your back, and we'll check for the internal rotation. Okay, good, turn around. Thank you. Now, what we'll do, we'll check for winging of the scapula. If you will, turn around. Since this isn't a wall, we'll have you pretend to do a push-up. If you can do that for me. Okay, good. And then now we'll test internal and external rotation. We'll have the patient flex his elbows at 90 degrees. Extend them out, or extend out, like that, and internally rotate. Can you do that? Good. And then that completes the range of motion for the shoulder. Moving on, we have passive range. It's where I will passively move the arm for the patient. And first, I will abduct the arm. Yeah, sideways like this. Just trying to rotate the arm. Okay, now we'll work on passive range of motion of the shoulder. What I'm going to do here, I'm going to stabilize this glenohumeral joint. I'm going to abduct the arm, externally and rotate, internally rotate. Here I'm just looking for range of motion and whether or not the patient feels discomfort or pain. What we'll do now next is stabilize the joint, abduct the arm, again checking to see if there's pain or any discomfort. Next, we're going to have some tests done where we will demonstrate various movements of the shoulder. The first is the Neers test. And what we're going to do here, stabilize here, bring the arm in a flex position, internally rotate. Okay, next we have the Hawkins test. I'm going to grab his elbow and his wrist. It's about 90 degrees. Passively internally rotate. Okay, what we're going to do now is continue on with testing our rotator cuff muscles. We'll begin with the supraspinatus. There's two types. The first is a resisted isometric abduction. What we're going to do, I'm going to have the patient bend his elbows and then bring him out a little bit. Hold it there. Don't let me move you. Good. Next, what we're going to have is an empty can test. I'll instruct the client to bring your arms out, all the way out. Extend them out like this. Hold the can. Tilt the can upside down. That's the empty can test. Thank you. You can relax. If there's pain felt, turn around. It's going to be in your supraspinatus right here. Turn around for me. The next two muscles we'll look at are the infraspinatus and the teres minor. And again, we'll bend the elbows. Hold it there. Don't let me move you. Good. And that is for your infraspinatus and your teres minor. Our last muscle we'll check is the subscapularis with a resisted isometric internal rotation. You can bend your elbows. And you bring them in over your stomach. Hold them there. Don't let me move you. Good. Thank you. You can relax. What we're going to do now, I'm going to have you turn around. Thank you. We're going to work on our scapular liftoff test, and this will complete the rotator cuff. What we're going to do is I'm going to have the patient bring your hand behind your back. There you go. And all I'm simply going to do here is lift off his back. Hold it there, don't let me move you. Okay, good. If there's pain here, if pain is felt here, then your subscapularis tendon is affected. Good. Now we'll do our biceps tendon testing. Most common is an anterior shoulder pain. First, we'll need to find the tendon, and in doing that, we will flex the elbow. Flex the elbow for me. Hold it there. The edge of the acromion. I'll drop my thumb down, externally rotate the arm, and it's right there. You'll find it slips right to the bicipital groove, and you'll feel for tenderness and pain. There's two tests administered with the biceps tendon. We have the Jurgensen's test and the Speed's test. With the Jurgensen's, again, we will palpate the tendon, flex the elbow, supinate the arm, hold it there, don't let me move you. And I'll rotate it, pronate it in, see if the patient resists. Okay, thank you. Relax. With the Speed's test now, the second, we'll do the same. We'll extend out the elbow. Patient hold it there. Don't let me move you. Okay? Hold it right there. Extend it out. Good. You can relax. Next, what we're going to move on to is the acromioclavicular joint testing, where we put stress on your AC joint, right here. This is known as the scarf test. We're going to bring the arm above, and we're just going to press on the elbow to put stress on the acromioclavicular right there. Or, another way we could do it, bring it up, and apply here as well. Thank you. Moving forward, we'll check the glenohumeral joint right here. We're testing for unidirectional and multidirectional stability. So what we'll do, we'll find the head, we'll move it posterior and anteriorly for stability. Then we'll move down lower for the inferior, and we'll just apply down on the elbow for resistance. Okay, good. Thank you. And then that brings us to our final test, the apprehension test. We'll bring the arm up. Externally rotate. And with this test, if the patient has an injury, they won't want you to do this. They think they might dislocate their shoulder. Okay, thank you. And that concludes the testing. Thank you.